May 21st, 2010, I was a patrol officer working the overnight tour 7 p.m. to 7 a.m. I'd been following a suspicious person around. Upon stopping him, it turned into a shootout and I suffered some injuries. Miraculously, I'm still here and still doing pretty well. And they examined my back and they examined my spine, that there was fragments across there was damage, and there's no surgical options. Basically, I had to live with the pain, keep my rehab up, and do the best I can. I had a knee injury in 2016, and I go and see Dr. Rubenstein over at Rothman. Obviously, at the time, I wasn't, and I'm still not an MRI candidate. I can't. He did his best to examine me and give me a diagnosis of what the injury may be. But without an MRI, and the option of an MRI, he couldn't be 100% sure.
Officer Blohm had persistent mechanical knee symptoms for over a year and a half.
Without the option of an MRI, you're limited. You really can't do it. And who wants a surgeon to open you up wherever it may be and try to do surgery to see what's going on in there?
So my eye was definitely a game changer for Officer Blohm, because this was an individual who put off having arthroscopy for a year and a half, and most likely may have put it off even longer because he could not have that MRI.
I didn't ask to be shot, and I didn't ask to be, have metal in my body.
And with the advent of the MyEye device, I was able to offer him a way in the office to diagnose whether or not he needed arthroscopic surgery definitively. When I'd seen him a year and a half before, we had not yet been using the MyEye device, and when it became available, we practiced with it in the operating room to get comfortable with it, and had already done it on patients prior to Ray. We offered it to him as that option to see if we could find anything that would lead him to the operating room.
It was quick, it was easy, it was virtually painless.
When I looked into Officer Blohm's knee, I was able to find evidence of loose pieces in addition to a medial meniscal tear, a tear of the cartilage between the thigh bone and the shin bone.
So I went from making an appointment, to within a couple days being in the office, getting my diagnosis, and then having my surgery the following week. It's just amazing.
Patients come into your office wondering what a diagnosis is, and the ability to actually sit across from them, 2 feet away from them, with a small needle, looking into their joint with them, watching the pathology on the screen is just extraordinary. You can't really do that in too many other fields.
If I would have known the MyEye was that convenient and quick and easy to get my diagnosis, I would have been next day.
The MyEye can potentially save somebody unnecessary surgery, as well as diagnose them and make them feel more comfortable about going to a surgical procedure.
If I actually could get an MRI and I had the choice of MRI or MyEye all the way.